Hi, everybody. My name is Lynae Vanee, and I am here with Nancy Pelosi and Elena Hung. How are you ladies doing today?
We're doing okay.
Okay.
Not great, but okay.
Okay. Okay. What is that okay feeling stemming from?
Well, we're feeling that we have seen a great outpouring of people coming here, as in Elena's case, to protect the Affordable Care Act and protect Medicaid in particular. I want Elena to tell her story as to why she is here.
So yeah, we are feeling okay. There is a lot of energy. We know that Medicaid is a life-saving program for millions of people across the country, including children with complex medical needs and disabilities, like my daughter in this case. Medicaid is what makes it possible for a lot of them to be able to live at home and go to school and access services so that they can survive and thrive. And what we're seeing, what we hope to see, is more attention paid to that. Because what we know is that Americans don't want to steal from disabled children in order to give tax cuts to giant corporations and billionaires.
Absolutely. Did you have something to add?
Well, I do want to say because we did this in '06 with when they went after Social Security, and 18 when they went after the Affordable Care Act, and we were successful in both times by the outside mobilization about people calling their Republican congressperson and saying, I'm your constituent. This is what I care about. I want you to know that, and my vote depends on it. We can't encourage them to lobby Congress, but we can encourage them to educate Congress as to the importance of Social Security, Medicare, the Affordable Care Act, and Medicaid. It's so important to not only children in our country, but families with seniors with long-term needs and other disabilities.
Okay. I think it's amazing that you've had success with this in the past, and I think indicative of a lot that we have to continue to fight the same battles over and over again. But we were dealing with a different beast at that time, and we're dealing with a different beast now. And with the way the media is being spun on the right side of the aisle, do you think your strategies have changed at all to focus maybe like on a younger audience or recruit a younger audience to help fight
Well,
this
it's not
fight?
about our strategy. Our strategies are the same to make sure the public understands, but our techniques are different. You're
Okay.
so right with the changes in technology and the ability to recognize how people receive their information and to be appealing to them the way they receive it, not the way we want to give it necessarily or have given it in the past. We have a younger generation of leadership. We have skilled workers on staff and all the rest in terms of technology and how to deliver the message. It's not the same way that we did in '06, and it's not the same way we did in 18, but it is the way that will be successful now.
Okay. And I'm wondering, Medicaid affects so many different Americans from so many different backgrounds, POC, African American, at different lengths and variations. And unfortunately, that piece of information isn't enough to, I guess, incite many voters to actually come to the table and meet you guys halfway in support. And so I'm wondering if addressing these different communities in a more personalized way is something that you guys have considered within the strategy.
Well, to have them be part of the messaging. We've learned so much when we were saving the Affordable Care Act, listening to the people say this is how this message would be better understood. Elena
Okay.
could speak to that because she has been working with people to convince other people of the value of
Yeah,
Medicaid.
you're
Okay.
right. And Medicaid affects so many people, like you said, and it's a very personal story, but it's also the same story when you think about it. It's there to help us survive and thrive. So
Absolutely.
we are, and like the speaker said, the values are the same, right? Our mission is the same. Our strategy, yeah, we're reaching out to different, to make sure that everyone's represented. We like to talk a lot about passing the mic, have everyone tell their own
Yeah,
stories,
for sure.
not have their stories being told, but tell their own stories.
Absolutely.
And along with that, hold our elected officials accountable.
Absolutely.
So we like to remind everyone, they work for us. They represent us. And so that's what our stories do.
Okay. I think that's amazing.
In 2000 and for 2018, we had 10,000 events around the country where people told their stories. We now have that again, protectourcare.com. People can tell their stories so that people can hear how they are affected, and members of Congress can hear that as well. The inside maneuvering that we do can just go so far. The outside mobilization makes all the difference. Lincoln said public sentiment is everything. With it, you can accomplish almost anything. Without it, practically nothing. However, for public sentiment to prevail, people have to know. So
Absolutely.
we have to speak to them or listen to them on their own basis.
Absolutely. I agree with everything that you're saying. What I do, I specialize in sort of demystifying and meeting people where they are as well. And just what I'm hearing so much of is just wanting to be seen in real, tangible ways. And I think of all the people that I've spoken to, there is an agreement that the Democratic Party itself has work to do in the way of making sure that people understand what faces are attached to what issues and how we're really striving in community. And so all I mean to convey is, yes, these are the issues across the board that the Democratic Party supports affects so many different Americans, and all of our struggle is the same. But I used to be a high school teacher, and something that I used to talk to my kids about is when you are putting a puzzle together, you don't get a chance to just slap all the pieces together. You got to first put the the pieces that look like one another together and fortify them to create a bigger picture, and so everyone can be strong and supported and seen. And so, yeah, that's all I'm thinking here. Yeah, and just wanted to make sure that the people doing the work understand where I'm coming from.
Well, we learn from the people that we're trying to persuade, and listening to them tell their stories instructs us on the vocabulary we would use, the attitude we bring to it, and the rest. And again, it's about respect. What do you say, Elena?
Yes, absolutely. That the reason I'm sitting here today is back in 2017. I was at home watching the news. I didn't see my story being represented. I didn't hear anyone talking about Medicaid and children with complex medical needs and disabilities. So what happened was I and a couple of friends said, look, we're a 30-minute train ride from the Capitol. Let's go. Let's show up. Let's make sure that everyone knows about our children. And that's what we did. And that one first day, with our kids roaming the halls of Congress in their wheelchairs and oxygen tanks and medical bags, turned into a second day, into a third day, and fourth day. And we came back week after week to tell our stories because we weren't seeing it being told. And so in terms of hearing from the real people, like I'm a real person. I'm a mom with a child with a medical needs. And so we're making sure that that platform is available to everybody.
Thank you.
Yeah.
Thank you so much for your work. Thank you for the work of the children. Thank you for supporting the issue. And I think we'll wrap up because you guys have somewhere to be.
Thank you so
Thank
much.
you.
Yes,
Thank
we
you.
do.